Ginger is widely used in both cooking and medicine for centuries. In recent years, ginger has gained popularity due to its health benefits. Ginger contains compounds called gingerols that help reduce inflammation and fight infection. They also stimulate blood flow and increase metabolism. While ginger can be an effective home remedy, it can also have side effects. Eating too much ginger can lead to digestive issues and irritation, among other problems. It's important to be aware of what these are before you use ginger on yourself or your family members and friends. Be careful, some people may also avoid this root entirely. For example, if you have the following health conditions, you may not want to use ginger. Or be sure to consult with your doctor before using it. 1. Blood disorders. Ginger can interact with some blood disorder medications, so it's best to discuss alternative treatments with your doctor before adding it to your diet. Ginger is often recommended for people who want to improve blood circulation in the body. But people with thalassemia or other forms of hemophilia may actually suffer severe hemorrhages due to the increased blood circulation. 2. Low body weight. Ginger has a number of side effects, including low body weight. Ginger is known to burn more calories than usual due to its thermogenic properties, which can increase your calorie burn. It has a negative impact on those who are already underweight. Taking medications for diabetes or blood pressure. Experts recommend that people on diabetes and blood pressure medication should avoid ginger. Despite its numerous potential benefits, ginger has a number of potentially harmful side effects that may not be known to consumers. So consumers should take precautions to avoid adding it to their diet. It can help to thin the blood and lower blood pressure, both of which can cause problems with these medications. 4. Unsafe during pregnancy. Though ginger can help pregnant women reduce morning sickness and weakness during the first few weeks, it is strictly prohibited during the 3rd trimester. Pregnant women are advised to avoid or limit their intake of ginger for safety reasons. According to gynecologists, ginger consumption over the recommended limit of 1,500 milligrams per day is associated with a higher risk of miscarriage and other complications. Ginger has been used medicinally for thousands of years. Excess ginger consumption, on the other hand, may have some serious side effects. As a result, limit your intake of this root and consult a doctor if you experience any side effects after consuming it. If you enjoyed this video, like, share, and make sure to subscribe. And remember, if you're not subscribed, hit that subscribe button and the little bell icon to be notified so you won't miss the new video.